Before the sun touched the horizon, the Nile was already awake. Its dark waters moved slowly, carrying life, memory, and mystery through the heart of Egypt. For thousands of years, the river had been more than water. It was a healer, a provider, and a silent teacher. Along its banks, temples rose, cities thrived, and knowledge was written not only in stone, but in flesh and blood. In the time of Cleopatra VII, Egypt stood between two worlds. One was ancient, sacred, and deeply rooted in tradition. The other was new, influenced by Greek science, philosophy, and rational thought. Medicine lived exactly at this crossroads. And within this world walked healers, physicians, priests, and scholars, each carrying the responsibility of preserving life under the burning sun. Neferu was born in Alexandria, a city unlike any other. She grew up among scrolls, voices of scholars, and the scent of ink and papyrus. Her father was a scribe. Her mother prepared remedies for neighbors using herbs, oils, and prayers. From an early age, Neferu learned that healing did not begin with tools, but with attention. When other children played, she listened. She listened to the elderly describe pain in their joints, to mothers speak of fevers in their children, and to sailors whisper about wounds that would not heal. She watched how the body spoke when words failed. At 16, she was accepted as an apprentice to the House of Life, the Peronk, where medical knowledge was preserved. There, medicine was not separated from religion or philosophy. To understand the body, one had to understand order, balance, and the will of the gods. The House of Life stood near the great temples, guarded by silence and discipline. Inside, walls were covered with shelves holding papyri written centuries earlier. These texts described diseases, treatments, surgeries, and prognoses. Some were practical, others symbolic, but all were respected. Neferu learned that Egyptian physicians believed the body was connected by invisible channels called metu. These channels carried blood, air, water, and spiritual energy. Disease occurred when the flow was blocked. Treatment, therefore, aimed to restore balance. Her teacher, Amenhotep, was an old physician who had served 3 pharaohs. The body, he said, is not chaos. It is order. When you see illness, you are seeing disorder. Students learn to examine patients carefully, observing the skin, listening to breathing, checking pulse, studying urine and stool, and asking about dreams and emotions. For Egyptians, the mind, body, and soul were inseparable. Every treatment began with respect. Before touching a patient, physicians often washed their hands and spoke invocations. Not because they feared the gods, but because they understood humility. Isis was called upon for healing. Sekhmet, goddess of plague and protection, was respected and feared. Thoth, god of wisdom, was believed to have gifted humanity with medical knowledge. Magic was not ignorance, it was language. Spells were often spoken alongside remedies, reinforcing belief and calming the patient. A calm mind, Egyptians believed, allowed the body to heal. Neferu noticed that when patients trusted the healer, treatments worked better. Centuries later, this truth would still remain. Cleopatra VII was not merely a ruler. She was a scholar. She studied astronomy, medicine, philosophy, and chemistry. She welcomed Greek physicians into Egypt but demanded respect for Egyptian wisdom. Under her rule, medical knowledge was discussed, compared, and expanded. Cleopatra personally supported the Library of Alexandria, where texts from Egypt, Greece, Persia, and India were studied together. She believed that power without knowledge was fragile. When illness spread among soldiers or servants, she demanded reports, causes, and solutions. Medicine, for her, was strategy. A healthy Egypt was a strong. One afternoon, Neferu was summoned to the palace. A young servant lay trembling, burning with fever. Amenhotep examined him in silence. The heat is not only in his blood, he said. It is in his fear. They prepared a treatment: willow bark for pain, honey for wounds and infection, garlic for strength, beer as a carrier for herbs. The room was cooled with wet cloths. Spells were whispered softly, not loudly. Healing required calm. Days later, the servant recovered. Neferu wrote the case down carefully. Every patient was a lesson. Egyptian medicine was not only gentle, it was precise. Physicians performed surgeries for wounds, fractures, and abscesses. They used knives made of bronze, needles, and linen bandages. Wounds were cleaned with wine or honey to prevent infection. Neferu once observed the setting of a broken arm. The physician aligned the bones, wrapped them tightly, and immobilized the limb with wooden splints. Prognosis was given honestly: a condition I can treat, a condition I will fight, a condition beyond my knowledge. Such humility defined Egyptian medicine. Unlike many ancient societies, Egypt allowed women to practice medicine. Female physicians, midwives, and healers were respected. Childbirth was supported with both medical knowledge and ritual protection. Neferu learned from older women who had delivered hundreds of children. They taught her how to recognize dangerous labor, how to support the mother, how to calm fear. Life entered the world surrounded by knowledge and care. In Egypt, death was not the enemy. It was transition. Physicians did not see death as personal failure, but as part of cosmic order. When a patient died, the healer ensured dignity and preparation for the afterlife. This perspective allowed physicians to work without arrogance. They served life, not immortality. Greek scholars studied Egyptian medicine. Roman physicians adopted their practices. Honey, garlic, surgical techniques, clinical observation, all traveled beyond Egypt. Neferu, now older, taught new students. She knew that names would be forgotten, but knowledge would survive. At night, Neferu stood by the Nile. Above her, the same stars watched as they had for millennia. Medicine, she understood, was not just science or magic. It was memory, it was responsibility, and it was hope. As long as humans sought healing, the wisdom of ancient Egypt would never truly disappear. The river flowed, the stars endured, and the art of healing lived on.